Dr. Ahmed Abdelsalam with topic Digitalizing Healthcare in Egypt Towards Digital Egypt 2030.
Thank you, Chairperson, for inviting me, and thank you, dear Harris, for the invitation. Welcome to Egypt again. Hopefully to see you every year, inshallah. We're landing on the ground now after the AI and science fiction. This kind of proposal of digitalizing the healthcare system in Egypt. I think we're still too far away from that, but I think we can consider this as a proposal. So the Egyptian population is around 120 million, with an average rate of growth between 1.5 to 2% annually, which is a kind of a big growth rate. We have physician density around between 9 and 11 per 10,000 capita, which is almost the half of the accepted global rate, which is 23 physicians per 10,000 capita. We have rising burden in non-communicable diseases like diabetes, hypertension, and other diseases like obesity, which is the thing that we're covering now. And the universal healthcare coverage is an issue that needs to be addressed. So why digital healthcare matters in Egypt? Because it facilitates access to care. We have vast majority of population that cannot access a good service with experts. It allows streamlined information, so seamless information flow, preventing critical data loss. When you have patients traveling from somewhere to another place, so we always face patients with losing the reports of the MRI, the CTs, the report of the pathology is lost. So if we have that digitalized, it will be easy to access this data. And this is how you will be supplying efficient and equal service, medical service to all populations. So COVID was a catastrophic pandemic, but it pushed the digitalization of the healthcare system and telemedicine. Almost all countries had vaccination platforms to facilitate the injections and so on. So the telemedicine integration was really facilitated and fastened during the COVID. The digital healthcare system is mainly have 5 pillars, which is electronic health records, telemedicine and teleconsultation, health information system, which is kind of platforms on the national level, just to document everything from the operations, data flow of the patient, administrative work, and wearables, as Dr. Adrian Barks said, wearables are now part of the healthcare system, either they're medical or not. The Fit bands, the Apple Watches, and everything, you can control it. The insulin, the glucose detectors, and these wearables are becoming part of the digital healthcare system. Artificial intelligence, we're feeding that all to the artificial intelligence to have good feedback from that. So on electronic medical records, it unifies the patient record. When you're taking history from an obesity patient, for example, if you're missing the sleep apnea, the GERD score, you will be taking wrong decisions, and then you will have medical errors. When it is unified, it will be much easier to take right decision. In Egypt, we have a challenges that we have fragmented system. We don't have unified medical record. The cost, at least in the beginning, will be high. The training of the medical personnel and interoperability issues. If you're dealing with a radiologist and lab technician, a physician, endocrinologist, this interoperability and between the physicians themselves and the hospitals is kind of obstacle for that. So the solution is to start a national standard electronic medical record, and it should be phases. It cannot be started as just one phase. The telemedicine and teleconsultation We have that, and as I said before, we have remote places that do not have access to expert medical service. They can do that by telecommunication, at least for the consultation in the first. And this will facilitate the access to a good medical service without overcrowding of the hospitals and decreasing the load. So the telemedicine will allow us to reach remote places, reduce hospital overcrowding, support chronic disease like diabetes and hypertension and so on, and this will be very cost-effective care delivery. Examples, as you all know, post-operative follow-up, most of us now are following patients, bariatric patients, by Zoom meeting and so on, and you can even provide that in the consultation pre-operatively, chronic disease, mental health. Many patients prefer to do the psychological assessment or psychological consultation online rather than visiting the clinic. So somehow it will be helpful, plus second opinion. If you're seeking medical advice from one doctor and another one in the States, in Germany, in UK, whatever, you can take second opinion online. This all will feed the AI model and AI and large language model that will help us in diagnosis, like in radiology. Now you can support the radiologist by some models of the AI. Screening of AF, many wearables now can detect AF, even the baseline of the AF. That will allow smart triage and clinical decision making. Instead of seeing every patient with the trauma, then you can feed the AI with the data, and then it will tell you this is priority, less urgent, emergency, and so on. Predictive analysis or risk stratification in chronic diseases like diabetes, hypertension, risk of complications during surgeries, and so on. So the challenges that we have in Egypt, we have some digital challenges and for sure legal challenges, and they're not particular in Egypt, they're I think worldwide. In Egypt we have infrastructure gaps. We have areas covered with good internet and some are not. We have interoperability issues, as I said before, between different categories and different hospitals and different care providers. Overcoming the resistance to change. Some people are against digitalization and they're not aware there is AI, there is support. And digital literacy, even if you're planning to do that, we do not have enough information to deal with that. The legal part is data protection, and I think it's not particular to Egypt or specific to Egypt, it's worldwide. Confidentiality of the patient. The informed consent, for example, how will you sign it? You need a confirmed digital or online signature. Developing clear regulation for telemedicine and AI tools. If you're making a consultation online for a patient and you're exposing him, see his wound, or doing a plastic surgery and you're seeing the patient online, how will you protect the privacy of the patient and this data from being leaked online? So we need to establish national digital health governance frameworks. The current status of the digital healthcare in Egypt, we have universal health insurance system in some governments like the Canal and the Luxor, and I think it's growing by 2030. They're taking almost 1/3 of Egypt to be covered by universal health insurance. Hospital information systems, a platform that covered the hospitals. It's partially adopted in universities, military hospitals, and some big private hospitals. Labs and radiology are very well digitalized. Now we do not see labs as papers, so the patient will send you the results, either on application or WhatsApp or whatever. And same goes for the imaging. E-prescription, we have pilot trials. It's almost individual between some insurance companies and clinics and so on, but it's not still nationwide. The telemedicine and digital services are growing in the private sector. Many of us now are consulting the patients online, but again, it's almost individualized. The unified medical records and data standardization, we're still behind that, and we need to grow it just to cope with the others. The roadmap towards Egypt, Digital Egypt 2030, we should strengthen the digital infrastructure nationwide. We should have a unified health record covering all over Egypt. Capacity building and training programs for the healthcare providers, the admin workers, public and private partnerships. And some of the private sectors are really, some of the private hospitals are really great in digitalization. They should have partnerships with the public part, encouraging innovations and healthcare startups. Hopefully, we'll be transferring from paper files to unified digital records, from isolated hospitals to connected megastructures, from reactive healthcare to predictive and preventive healthcare. Hopefully, we have a digital healthcare in Egypt designed by doctors, driven by data, and centered to the patients. And thank you.
Thank you very much, Dr. Ahmed, for the nice presentation. Now we can take some questions from the audience. Do you think it will come to a stage that we don't need to supervise the AI? He will do the job himself and we can rely on him? At the beginning, when they have introduced the navigation system was showing us roads which were not existing. Some people, they did accidents, but nowadays it's better. And the same thing with the AI. Sometimes may show us safety, which is not safe, or risk, which is not the risk. Do you think it will come to a stage that it will be not the case?
I think at some point will be like pilots, so we'll just be taking off and landing, and during the whole cruise, the machine will take over. Probably it will be that. I'm not sure when, but feeding the data to the AI, I think it's helping. But for now, for me, it's somehow it has so misleading decisions. As you said, it's safe and it's not safe, critical, it's not critical, and so on. But I think at some point it will be that, yeah.
Thank you, Ahmed, for an excellent presentation. The reason I gave you this presentation is about 6 months ago I was doing some reading, and I'd like to know what's going on with healthcare systems around the world, and this was really a very important topic. My question for you is digitalizing healthcare in Egypt. Do you have a rough idea how much it's going to cost? Because these things are not cheap. And it's great to have the vision, but to make the vision a reality is a different thing. Do you have a rough idea on how it will be? You mentioned about public-private funding. Do you have an idea that, is it going to really be there by 2030, or will there be more time, or will it be a very higher cost to the country?
For the cost, I don't have any estimate about that, and I don't think it will be 2030. I think it will be covered in a phase in 2030, especially in the governance that's not that crowded like the central Egypt, Cairo and Giza and so on. They started with the governance at the Suez Canal, so because they're not that crowded, and they can implement that. They have enough hospitals, enough healthcare providers. I don't have estimate for that because I think it's very costly, especially at the initiation of the program, from the software to the hardware to the support, the training and so on. Unfortunately, I don't have that number.
Well, thank you very much. I hand over to Professor Sami to close the keynote session and introduce the next session.